Thank you. Well, kids as young as 12 could get the Pfizer vaccine as early as tomorrow, and today a CDC panel is meeting to discuss that rollout.
Yeah, but there are a lot of parents out there with questions over safety. Joining us today to talk a little more about that is Dr. Celina Nadelman. She's currently helping distribute vaccines over in the Los Angeles area. Dr. Nadelman, great to see you. Thanks for joining us today.
Thank you for having me.
Well, first of all, what do you tell parents who are on the fence about this vaccine for their children?
Well, I think it's been shown to be pretty safe in adolescents between 16 and 25 years old, and has the same side effects as most adults have gotten, soreness in the arm, maybe a little bit of body aches or fevers. Maybe a little bit more fevers were seen in the younger age group just because they have a more robust immune system, which means that they can fight it off even better. But it has been really, really safe, and I do recommend that children between the ages of 12 and 15 go ahead and get their vaccine.
And we understand that you're big on talking about the impact of their well-being of the children, mental and social health as well. Doctor, can you further explain that?
Well, I think a lot of this stems from the fact that many of the adults that have been vaccinated kind of face this conundrum of, what do I do with my children? I'm vaccinated, they're not vaccinated. We can go visit grandma, but what if my children, get corona? Can they, visit grandma? This opens up the door to their social, emotional well-being. They can attend extracurricular activities, sports, music, in-person classes, art. In addition, getting the vaccine sooner rather than later, it allows them to participate in things like summer camp, sleepovers, get-togethers. These are things that these children really, really want and have been missing for the past year. It's been really, really hard on them, especially the younger age group. The older kids, I think they're a little bit more used to being on their phones and socializing through video and electronics, whereas these younger children really have been suffering from this. And this kind of opens the door. They'll also be able to do much more interactive things, and getting them vaccinated sooner rather than later also helps schools open up in the fall for in-class learning, in-person learning, without the fears of coronavirus outbreaks.
And Dr. Nadelman, I think a lot of people are curious to see if this is also going to help us to reach herd immunity a little bit faster. What are your thoughts?
Well, it's very hard to predict about herd immunity. Right now, as it goes, we have to have about 60 to 75% of people with antibodies to COVID-19. That means those people who have either been infected and have antibodies, but we know that they don't last very long, or those people who have a vaccine and have antibodies against COVID-19. Now, about 20% of the U.S. population is made up of children, so that would really help us push our numbers towards that 60 to 75%, especially since a lot of adults are hesitant to get the vaccine. In addition, if we're vaccinating our children, they no longer are reservoirs for COVID. A lot of these kids may not get severely ill, but they can still serve as reservoirs for the virus to kind of bounce around people who are not vaccinated and don't have antibodies, and which allows the virus to even mutate further, which then could be even worse for us. And so the sooner we all get antibodies, either through infection or through the vaccine, the closer we get to this herd immunity. And also, it all tamps down the possibility of getting more dangerous variants of coronavirus.
Excellent. All right, Dr. Nadelman, if you'd like to learn more about her, you can visit her website at drnadelman.com. As always, great to have you.
Thank you.
Thank you. Turning now to weather.